Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll review therapeutic ultrasound. We'll cover how it works, when to use it, and how to select parameters based on your treatment goals. Before we select specific settings, we'll use the FIT framework to organize our decision making. We start with type. This refers to the treatment goal, such as thermal or non-thermal effects. Next is frequency, which determines how deep the ultrasound will penetrate. Then intensity, which controls how much energy is delivered to the tissue. And finally, time, which is the total treatment duration. The treatment time varies depending on how we set up the other FIT variables. Using this framework helps guide parameter selection based on the patient and the treatment goal. Let's start with frequency. It is important to remember that frequency, not intensity, determines the depth of penetration. 3 MHz targets more superficial tissues, typically less than 1 inch deep, and heats faster. 1 MHz targets deeper tissues, typically 1 inch or greater, and heats more slowly. So frequency selection depends on the depth of the target tissue. One thing you will see often with ultrasound settings is that one setting affects the others. For example, frequency directly affects intensity selection. Since 3 MHz targets superficial tissues, it will build up heat faster. Thus, it will require a lower intensity. On the contrary, since 1 MHz targets deeper tissues, it will heat more slowly. Thus, we will use a higher intensity. So for the same treatment goal, we adjust intensity based on the depth of the target tissue. Intensity refers to the strength of the sound wave energy, not the depth of penetration. If the intensity is too high, it may lead to excessive heating, while if it is too low, the therapeutic effect may be reduced. In clinical practice, intensity often needs to be adjusted based on patient comfort, especially in more sensitive areas. However, when intensity is reduced, less energy is delivered into the tissues, which can decrease the overall treatment effect. As you will see, when energy delivery is reduced, treatment time often needs to increase to compensate. So while patient comfort is always a priority, adjustments to intensity should be paired with adjustments to time to ensure an effective dose is still delivered. Now, let's look at the type or mode of ultrasound. Thermal ultrasound uses a continuous setting, which means a 100% duty cycle. In this mode, energy is delivered continuously, resulting in heating. In contrast, non-thermal ultrasound uses a pulse setting, in which the duty cycle is the percentage of time the ultrasound is on. A 50% duty cycle provides a higher dose pulse stimulus for non-thermal effects. However, if heating becomes a concern, a lower duty cycle, such as 20%, can be used to reduce overall energy delivery, while still promoting mechanical effects. Now let's talk about treatment time. This is where things start to come together. Treatment time depends on several key factors, specifically the treatment area, the intensity, and the duty cycle. If the treatment area is larger, the sound energy is spread over a larger region, so less energy reaches any given point, which means more time is required. Next, if you need to lower the intensity for patient comfort, less energy is delivered to the tissues, so more time is required to achieve the desired effect. Now looking at duty cycle, if the ultrasound is pulsed, it is on only part of the time, so less total energy is delivered than with continuous ultrasound, which again means the time must increase. When we step back, there is a consistent pattern. When energy delivery is reduced, time needs to increase. And this is the key idea. Time is how we make up for less energy delivery. Here's a flowchart that will help organize this process. However, I want to clarify how to interpret the treatment time. The time values shown are intentionally a bit more conservative to help avoid underdosing. When considering treatment time, it should be based on the size of the treatment area, which you can estimate from the sound head's effective radiating area, or ERA. The ERA is slightly smaller than the sound head surface, but it serves as a good reference. In most cases, you should be treating an area that is about 2 to 3 times the size of the sound head. For a small treatment area like this, you can use the time ranges shown in the chart. However, if you are treating a larger area, the energy is spread out over a greater region, so you will need to increase the total treatment time. As I said before, one thing you will see often with ultrasound settings is that one setting affects the others. Let's walk through one path on the flow chart. We will start with a chronic condition in which the goal is thermal effects, so we select continuous ultrasound. Next, we consider the depth of the target tissue. If the tissue is superficial, we select 3 MHz. Because 3 MHz heats more quickly at superficial depths, we choose a lower intensity. Now, even though we mentioned earlier that lower intensity typically requires more time, that idea assumes the frequency is the same. In this case, 3 MHz delivers energy more efficiently to superficial tissues, so even at a lower intensity, the treatment time can still be shorter. So as we move through this path, you can see that each setting is not chosen in isolation. Frequency and intensity together determine the treatment time required to achieve the desired effect. Now let's walk through the same process using 1 MHz with a continuous setting. We again start with a chronic condition in which the goal is thermal effects, so continuous ultrasound is selected. This time the target tissue is deeper, so we choose 1 MHz. Because 1 MHz penetrates deeper, it heats more slowly at depth, so we select a higher intensity to achieve the desired thermal effect. In addition, because energy is delivered less efficiently to deeper tissues, the treatment time is often longer. So even though intensity is higher, more time may still be required to achieve the same overall effect. This reinforces the idea that frequency, intensity, and time all work together and must be adjusted based on the depth of the target tissue and the treatment goal. Okay, now we will walk through the same path using 3 MHz with a pulse setting. We start with an acute or subacute condition, where the goal is non-thermal effects, so we select pulsed ultrasound. In this case, we are using a 50% duty cycle, which represents a higher dose pulse setting. Next, we consider depth. Since the target tissue is superficial, we select 3 MHz. Because we are not primarily trying to produce heating, the intensity is typically kept lower, such as around 0.5 to 1.0 watts per square centimeter. However, because the ultrasound is on only part of the time with a pulse setting, less total energy is delivered than with continuous ultrasound. As a result, treatment time is often increased to achieve the desired non-thermal effects. So even though we are using a lower intensity, the pulse nature of the treatment means we adjust time upward, again reinforcing that these variables all work together to influence the overall treatment effect. To wrap up, let's walk through this path using 1 MHz with a pulse setting at 50%. We start with an acute or subacute condition, where the goal is non-thermal effects, so we select pulsed ultrasound. A 50% duty cycle represents a higher dose pulse setting. Next, we consider depth. Since the target tissue is deeper, we select 1 MHz. Because we are not primarily aiming for thermal effects, the intensity is typically kept lower, often around 0.5 to 1.0 watts per square centimeter. However, 1 MHz delivers energy less efficiently to deeper tissues, and with a pulse setting, the ultrasound is only on for part of the time. This means that overall energy delivery is reduced from two directions, both depth and duty cycle. As a result, treatment time is often increased to achieve the desired non-thermal effects. This again highlights that when energy delivery is reduced, whether due to depth, intensity, or duty cycle, treatment time must be adjusted to compensate. To wrap up, the most important concept is that ultrasound settings do not work in isolation. They interact with one another. Frequency affects how quickly tissue heats and at what depth, which then influences the intensity and treatment time. 3 MHz targets superficial tissues and heats more quickly, so it typically requires lower intensity and shorter treatment times. In contrast, 1 MHz targets deeper tissues, heats more slowly, and often requires higher intensity and longer treatment times. Duty cycle also plays a role. Continuous ultrasound delivers more energy and produces thermal effects, whereas pulsed ultrasound delivers less energy, so treatment time is often increased to compensate. Finally, the size of the treatment area matters. As the area increases, the energy is spread out over a larger region, so more time is required. Overall, when energy delivery is reduced, whether due to depth, intensity, duty cycle, or area, treatment time needs to increase. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.